adjustments to the agenda? If not, a motion to approve. Motion to approve by Commissioner Furr. Is there a second?
Second.
Second by Commissioner Allman. All those in favor, please say aye.
Aye.
Any opposed, no. Motion carries 7-0. Item number 1 on the agenda tonight is a proclamation declaring March 2019 as Social Work Month. Our presenter this evening will be Miss Dolly Clayton.
Good evening.
Evening.
So I come to you to bring forth the March 2019 Social Work Month proclamation for consideration and approval. The theme of Social Work Month 2019 is Elevate Social Work. And this campaign was developed for the purpose of educating the public about the contributions that social workers have made to society and why the profession is so vital to this nation. Social workers go through years of education to learn and to hone their professional skills so that they can help others reach their full potential. In addition, social workers take many continuing education courses each year to make sure their skills remain on the cutting edge. Social workers are trained to look at situations in a holistic way, bringing people together with others in their communities to find ways to address pressing issues, individual, group, and society problems such as hunger, affordable housing, equal rights for all, and making organizations and governments accountable. Social workers also follow the NASW Code of Ethics, which calls on members of the profession to enhance the human well-being and help meet the basic needs of all people, with particular attention to the needs and empowerment of people who are vulnerable, oppressed, and living in poverty. So I brought to you tonight the proclamation to determine March 2019 as Social Work Month, and I'd like to read it to you. Whereas the social work profession is dedicated to enhancing the well-being of others and meeting the basic needs of all people, especially those who are vulnerable, oppressed, and living in poverty. Whereas this year's Social Work Month theme, Elevate Social Work, embodies the need to recognize the extraordinary contribution of the profession to our society. Whereas social workers elevate and empower people, giving them the ability to solve problems, cope with personal roadblocks, and get the resources they need to succeed. Whereas the social work profession is deeply weaved into our society, with social workers active in government, schools, universities, social service agencies, communities, the military, and in healthcare and mental health settings. Whereas social workers are the largest group of mental health care providers in the United States and work daily to help people overcome depression, anxiety, substance abuse, and other disorders so that they can lead more fulfilling lives. Whereas social workers travel across the nation and the world to help people in times of crisis, helping them overcome issues such as death and grief, helping people in communities recover from disasters such as hurricanes and floods. Whereas social workers for decades have been in the forefront of social justice, pushing for equal rights for all, regardless of gender, race, ethnic background, disability, sexual orientation, and/or other various ethnic, cultural, and religious affiliations. And whereas thousands of child, family, and school social workers across the country provide assistance to protect children and improve the social and psychological functioning of children and their families, and whereas social workers work with older adults and their families and improve the quality of life and ability to live independently and maintain access to quality mental health and health care, and whereas the social work profession for more than a century has been on the cutting edge of helping create changes in the way make our society a better place to live, including voting rights, improved workplace safety, minimum wage, and social safety net programs that ameliorate poverty and hunger. And whereas social workers stand ready to help our society overcome current pressing issues, including immigration reform, equal rights for all, affordable and good health care, and mental health care for all, and protecting the environment. And whereas, I'm hoping you'll say, the Stanley County Board of Commissioners will join the Stanley County Consolidated Human Services Board and the National Association of Social Workers and other interested agencies and organizations recognize the impact social work has on the strengthening communities across our state. Now, therefore, in recognition of the numerous contributions made by Stanley County social workers, we, the Stanley County Board of Commissioners, do hereby proclaim the month of March 2019 the Social Work Month and call upon all residents to observe the month by celebrating and supporting social workers and the social work profession. We have social workers who are employed by Stanley County that work in social services, the health department, and in senior services. And so I'd like for you to recognize all of them as well as those who work in the Stanley County school system.
Thank you, Ms. Clayton. Is there any questions from the board? There's no questions. What's the pleasure of the board?
Mr. Chairman,
Commissioner Lawhorn?
I would like to make the motion that Social Work Month, March 2019, be proclaimed and this proclamation be signed.
Motion by Commissioner Lawhorn. Is there a second?
Second.
A second by Commissioner Morgan. Is there any other discussion? All those in favor, please say aye.
Aye.
Any opposed, no. Motion carries 7-0.
Thank you so
Thank you,
much.
Ms. Clayton. Next on the agenda tonight is the Stanley County Dental Clinic is receiving a grant. Our presenter this evening is Dr. Mindy Turner.
I'm presenting on the Duke Endowment Grant. It's the School-Based Oral Health Initiative Program, and we were chose out of 8 school-based programs in North and South Carolina. There are 4 in North Carolina. We're considered a safety net dental clinic, and we are able to receive grants from Duke to go into our middle schools and provide dental sealants on the 6th, 7th graders. The first phase is the readiness phase. It's $65,000, which we've been awarded, and hopefully that will be accepted at tonight's meeting. We have a chance of up to $195,000, so there's a second and third year of the process. So the readiness phase is to help us develop a delivery plan. Duke Endowment has partnered with the Medical University of South Carolina, and we have trainers who are helping us develop care plans. And we're also going to hire a staff person to help with data entry. There's some needed software updates that we need to do, and we also need to update some of our mobile equipment. So the second year is going to be the actual program itself, where we're in the middle schools performing the treatment on the children, and we'll have to continue to submit the data and work with our technical team. Same thing for year 3. And while sealant's important, they help the teeth keep from being decayed, and the overall health is affected by dental health, of course. We are already in 11 of the public elementary schools providing sealants to the 6-year molars in our 2nd and 3rd graders. We've been doing that since 2016. Duke Endowment gave us a $65,000 grant then to start the program. And so the next phase is that we're adding the middle schools, the 4 middle schools that we have. And why the molars? They're the most frequently decayed teeth, and the stats are really good. The first one is from the ADA website, but if we can use sealants on those molars, we can reduce the decay rate by like 80%. So that's awesome. And kids without the sealants are 3 times more likely to have cavities. And a big thanks to Duke Endowment for supporting us in the past, and we have an opportunity for $195,000 to continue in our middle schools. And another huge thanks to the school health nurses who make the program work that we have already. And tonight, somewhere on your agenda, I know we need to make an amendment to the budget. Are there any questions for me?
Thank you, Dr. Turner. Does anybody have any questions?
Mr. Chairman.
Several questions. We'll start at one end.
Go ahead.
Commissioner Lawhorn.
Dr. Turner, do you all go to the schools to do the sealants?
We do.
And I guess my second question, I guess if I'm a parent of a student, I'm notified that they're going to get this?
Yeah, that's where the school nurses come into play. So we actually send home the permission form and a brochure explaining the sealants to the parents.
Do the majority of the students get the sealants?
I would say at least 50% do. A lot of the students in, East Albemarle Central are patients already, and the parents know that we've already sealed those teeth. So, yeah, we have a really good return rate, and the school nurses are great. They send reminders out after they've sent out the forms, so trying to follow up and get some more kids in. We were actually at Norwood today. So,
Thank you.
sure. Any other questions? Yes.
In terms of equipment, you're getting $65,000 the first year. It seems like it's going to handle equipment and kind of getting you started. What are
Well-
you looking at? Are we talking like DR?
So our first, they call it a portal system. So we have a van that we purchased the first year. And so we already have portable dental units that we take into the schools. The school health nurses actually help us find a room in the school, hopefully with a sink in the room. But we were able to move the equipment in, so it kind of looks like a dental office while we're there. We're able to set up the morning of the first day of the program, and then usually by the second day we tear down. Sometimes with the bigger schools it's a 3-day process, but usually 2 days we can do about 30 kids per day.
Because my concern was, like, if we were buying equipment like digital radiography or something, those
No,
are incredibly expensive, and I was afraid the money would not be adequate. But that's
no.
not the kind of equipment that you're talking about.
No, and we're only doing sealants. What we do is a referral process. So if we have children who have decay on the molars and we are unable to seal them because of that, then they can either be referred back to our clinic if they don't have a dental home, or we have the school nurse contact the parents so they can get additional treatment. But we actually have on our consent form that says we are unable to detect decay in between the teeth because we do not take x-rays. So we want the parent to know that there could be decay there that we can't see clinically.
Thank you, Dr.
Commissioner Morgan?
I actually have two questions. First, I just want to verify, so you get $65,000 with the grant this year. So do you have to reapply for the grant for each following year?
We do.
Okay. My next question is, since you said this includes hiring a new employee, are they going to be hired based off if we get funding for the following year, the third year, and so forth? So
That is correct, and it's a part-time person who actually retired from the oral health section.
Any other questions? Seeing none, what's the pleasure of the board?
Mr. Chairman,
Commissioner Lawhorn?
I make a motion that we approve the acceptance of the Duke grant.
Motion to accept the grant funds. Is there a second? Second. Second by Commissioner Morgan. Any other discussion? All those in favor, please say aye. Aye. Any opposed, no. Motion carries 7-0. Thank you, Dr. Turner. Next is the Sheriff's Office Canine Surplus and Canine Purchase. Center is Chief Deputy Thompson.
Good evening.
Good evening, Mr. Thompson.
Hi. Got two parts. One, we have a young dog, actually only had about 18 months. We're going to have to retire due to hip problems. It's already been basically retired by the vet. We can't put it back in service. And what we're asking it to be turned over to its handler. But when we turn it over, he also assumes all medical responsibilities from which he is aware of, which will be Francisco Porres is the one that's had the dog with him.
Thank you, Mr. Thompson. The first part of that, we have to review turning the dog over. My question is on, and I'm sure I've asked this before, but liability-wise, does he assume that liability for?
I understand he will sign a sheet with this. It's already been done in the past, and he gets all liability, medical and otherwise.
Okay.
Yeah, once they're surplus, it's no longer it's no longer the county's responsibility.
Right.
So
Thank you. Are there any other questions from commissioners on that?
Mr. Chairman, I have a question for County Attorney.
Commissioner Jordan?
I don't think this is a contentious issue, but my wife is the owner of that clinic. I know Dr. Yao. I know the dog. Is there any reason I should or should not recuse myself from this?
I don't believe that you have a conflict here. I think you have a statutory duty to vote, and I don't think that this would rise to the level of a conflict, so I think it's okay for you to participate.
Thank you.
You're welcome.
Thank you. What's the pleasure of the board?
Mr. Chairman, I make a motion that we turn over the retired canine and surplus canine, Cato, to his handler, Deputy Francisco Porras.
Motion to turn over the K-9 to his handler from Commissioner Allman. Is there a second?
Second.
Second from Commissioner Furr. Is there any other discussion?
I know from the veterinarian in question and the officer in question that there is no better officer she would rather turn that dog over to. That she has that vet has a high respect for that particular deputy and that dog. So I very greatly support it.
Thank you, Commissioner Jordan. Any other discussion? All those in favor, please say aye. Any opposed, no. Motion carries 7-0.
All right, thank y'all for that part. The other part, we like to replace the dog. We have been searching around, and we actually found a local handler or breeder here in town that's willing to give us one for $8,500. It's a discount at $8,500. The other prices are running between $14,000 and $19,000. We thought we had one, and he actually insisted us to take it to the doctor's office for the vets, and it actually showed up in the x-ray, and I'm learning too. So after a year and a half, they can actually x-ray and look for that problem, and this dog was at that age, and they found an issue there. So he's actually got 2 more we're fixing to look at, but he's guaranteed that price and equivalent dog to what we want. And he will be here locally here in the county. And what we're looking at is moving money from the forfeiture, seizure, drug seizure money for the purchase.
Deputy Thompson, is this can you disclose who the breeder is? I mean,
Gabe
name who-
Smith. Gabe Smith.
Gabe Smith.
He's actually given us a 2-year guarantee from the date of purchase also, which the other ones are wanting to give us a year that we're looking at.
Is there any other questions for Deputy Thompson?
Does this? It's $8,500 for the dog.
And training.
That was my next question.
Yes,
Okay,
that's-
good. So, and his K-9 cert,
Yes.
that's great. What about, and he's gonna guarantee the dog for 2 years, so if 18 months in, Dr. Yao or another veterinarian finds hip dysplasia or myoplassia in the animal, he'll replace the animal?
That's what he told me, but I will have it in writing. That's part of the deal. He would have to give it to us in writing, what he is actually guaranteeing us. And he said he would agree to that. He already gave me a rough draft of what he would do, and we would actually take it to the attorney and get our side done of what we were looking for.
So he's just saying for $8,500, you'll have a good dog.
Yes.
Thank you.
No other questions. We'll entertain a motion to approve the budget amendment.
Mr. Chairman,
Commissioner Morgan,
I'd like to make a motion that we approve the budget amendment as presented for $8,500 for the purchase of a new K-9.
motion by Commissioner Morgan. Is there a second?
Second.
Second by Commissioner Allman. Any other discussion? All those in favor, please say aye. Any opposed, no. Motion carries 7-0.
Thank you very much.
Thank you, Deputy Thompson. Item number 4 tonight is the Cardinal Health County Commissioner Advisory Board appointment. Presenter, County Manager Lucas.
Thank you, Mr. Chairman, members of the board. The County Commissioner Advisory Board is set by statute. This is basically the board that consists of one commissioner from each of the 20 counties in their catchment area that basically recommends and nominates individuals to serve on their larger board of directors, basically the governing body for Cardinal Innovations Healthcare. And they meet a couple times a year to consider those applications. Previously, Commissioner Eford, who was also the member on the local board for Cardinal Innovations Health, served in that capacity. So they have another meeting coming up at the end of the month, and they're seeking to have a replacement for Stanley County on the County Commissioner Advisory Board.
Thank you, County Manager. Is this different than the Cardinal Health that Commissioner Lawhon already, aren't you on that?
I'm on this called Advisory Board for Piedmont Mental Health, which is part of the call.
Okay. So this is a higher level board, if I'm understanding that correct.
The board that Commissioner Lawhon's currently on, it looks at issues that are occurring here in the Piedmont area. This board is actually a board that meets a couple times a year that Cardinal has, that is represented by one person from each county, one commissioner from each county, that makes nominations to the larger governing board of Cardinal Innovations Healthcare. So Those folks then are folks that are on the larger governing board that make policies, procedures, look at budget for the entire Cardinal organization.
Thank you, Mr. Manager. Is,
I just had a quick question. So former Commissioner Eford, he served on both boards, correct?
He did, because of his knowledge
Do
of,
both.
at the local, yes, you can certainly do both, because of his knowledge at the local, on the local board, and he was fine with being placed on this, Commissioner Advisory Board that made nominations to the larger board. And really this, it kicked in when Cardinal had all of their issues and there was a lot of turnover and they had to have a brand-new board put in place. That's when that board first met, and Commissioner Eford volunteered to serve on that board. And now that he's no longer on the board, we have a vacancy.
So my next question was, Mr. Commissioner Lawheim, would you be willing to serve?
I will, provided I have. I would be happy to serve. You all feel like